Okay, so today we are going to give some medications for Mila Bush. So I have her chart pulled up, and it looks like her date of birth is going to be March 28th, 1945. She does have some allergies to indomethacin. She is scheduled for 2 medications today. It looks like it's for benzapril hydrochloride, 20 milligrams, and she's receiving that orally. And she's also scheduled for Docusate, 100 milligrams, and that is orally as well. So we are going to perform our first med check. Okay. So our first medication is going to be for benzapril. This is going to be for 20 milligrams. This is going to be taken orally, and this is intact and within range. It expires April 2026. Looks like she's going to be receiving 1 pill. And then the next medication is going to be for Docusate. This is 100 milligrams that she will be receiving. This is going to be orally. This is intact. This is within range. It expires March of 2025. So it looks like we have our correct medication for Mila Bush. Correct dosage, 100 milligrams for Docusate to be given daily by mouth. And we have our benzapril, 20 milligrams to be given daily by mouth as well. And we are giving those today at 2:07 p.m. So we're going to go in and see Miss Mila Bush. I'm going to get a cup of water. Please. Before I go in there really quick, I'm going to take a look at her results, some vital signs. So just to confirm, she does have allergies to indomethacin. She did have her blood pressure taken recently. It looks like it was 118/66, which is within range. Her pain level was out of 5. Okay, perfect. So let's go see her client. Okay, knock, knock, knock.
Hello.
Hi, my name is Heather. I'm going to be your student nurse today. Could you please verify your name and date of birth for me?
It's Mila Bush, 3/25/1945.
Okay, perfect. And do you have any known allergies, Maya?
Yes, indomethacin.
Indomethacin, okay. So I'm here to prescribe some medications. To give you some medications that your doctor has prescribed. Before we go over the medications, I just want to ask you a few questions. Looks like your blood pressure was taken earlier by the CNA, and that was 118/66, which is within range. When was your last bowel movement?
Yesterday.
Yesterday? Okay. And how would you say your bowel movement was?
It was almost normal.
Almost normal? Okay. Let me get that notated here. Okay. So I'm going to hand sanitize, and then I'm going to perform my second med check. Okay. I'm going to scan your armband. See if this. Maybe a third time's the charm. Okay, we'll just pretend it scans. Okay, so it pulls up that I do have the correct patient, Mila Bush. I do see her date of birth, and I do see her allergy. Okay, so for my second med check, I'm going to verify that we do have benzapril. We have 20 milligrams. She is scheduled to have that today, right now at 2:10 p.m. She is receiving this orally, and this is intact and within range. And then her second medication is going to be for Docusafe. This is 100 milligrams. This is a tablet. She will receive one. This is scheduled for today at 2:10 p.m. This is intact and within range. Okay, Mila, so you are going to be receiving 2 medications today. One of them is going to be benzapril, and it's going to be 1 tablet. This will be for your blood pressure. Since your blood pressure is within range, this appears to be doing its job. It's helping you stay within range and not too high or too low. Some side effects to look out for will be dizziness, lightheadedness. You can also feel dizzy if you stand up too quickly. So we do want you to use your alarm to notify us if you do need to stand up, so we can be with you so you don't fall. The second medication you're receiving is Docusafe. This is to help you with your constipation, so you should start to experience some soft stools. If you do notice any upset stomach, diarrhea, nausea, let us know and we can come in and kind of take a look and see what's going on. Do you have any questions about the 2 medications you're receiving today?
No.
No? Okay. So I'm going to perform my third med check. Let me see if I can get this to scan. Okay. And just to confirm for my third time, I do have Docusafe 100 milligrams. This is a tablet for Mila Bush. This is for today's date for 2:12 p.m. This is intact and within range. I'm going to open this. Okay, and then for my second medication, going to confirm that I do have the benzapril 20 milligrams. This is going to be 1 tablet. This is for Mila Bush for today's date, and this is for 2:13 p.m. This is going to be intact and it is within range. I'm going to open that for her. Okay. All right, Mila, I'm just going to raise the bed so I can give you some medications. Do you have a preference if you want to take one or both at the same time?
I'll take both.
Oh, okay. Okay, so I'm going to have you take a sip of water. Okay, I'm going to have you take your medications. Okay, and then I'm going to have you take another sip of water. Perfect. And then do you mind just kind of opening up your mouth and moving your tongue around for me? Okay, looks like those went down fine. Perfect. Okay, so I'm going to go ahead and lower the bed. We'll keep you raised a little bit there. Okay, perfect. I'm going to go ahead and give you the call light. And then I'm going to dispense the trash. Okay, and then we went over those side effects. So again, if you do need to get up for any reason, or if you do start to experience any nausea, upset stomach, diarrhea, please use your call light so we can come help you. Again, we want to avoid any faults. So I'm going to finish my documentation. Okay, perfect. So if you don't have any questions, then I will be back in about 40 minutes to check on you. And then just use your call light if you need anything, okay?
Okay.
Okay. Thank you, Mila.
You're welcome.